today is just we're going to talk a little bit about your transition to the UK,
Okay.
and what your thoughts are on the NHS. So we'll start from the beginning.
Yeah.
What actually motivated you to relocate to the UK in the first place?
Yeah. So initially, coming from a very small island, looking to progress professionally, UK has, and the NHS has been over here. I mean, they're established for over a long time, and it helping me to realize certain goal and target that I have put for myself. Moving here was just like, it make a platform for me to realize all the points for me. Now, as you know, I started in emergency medicine. As in my country, it's not a specialty as such. It's just in like a triage type of department that it is. But here, you get to do pre-hospital emergency, you get the hospital emergency, you can specialize into pediatric emergency. Uh, it's a bigger platform. So this is one of the reasons why I choose to move to UK and to choose to work in NHS.
Yeah, I think definitely it's a lot of different changes
Yeah,
within
yeah, it
the
has.
system, and you'll get a lot more exposure here in the NHS as well. You'll learn a lot more.
Yes, yes, definitely.
Um, okay. Well, in terms of your experience back home, I know you were working in a fitness center very recently before you joined
Yes,
the
yes,
NHS.
yeah.
I think you had a rotation in emergency medicine previously as well.
Yes, yes. I
Uh,
have a small rotation back when I
yeah.
was in my pre-registration training.
Okay. Can you maybe outline some of your responsibilities when you were working in emergency medicine overseas?
So I had a small glimpse of it when I was doing a student internship that was in China.
Hmm.
So it's very small, like 2 3 weeks exposure. Um, so over there, as you can imagine, it's fast paced and you
Yeah.
see from minors to major, it's coming, big rush and always rush. So it was quite challenging at first, but quite scared because I was still a medical student, so it was a
Yeah.
student internship. Then second time I got exposed in emergency medicine was back home when I was doing my pre-registration training. I thought sure was a small period of time. Here you get to see, how you manage acute cases that come to the door. As I said to you before, it's not as established as a department. It's just a small triage in which we see the quick management and then they refer to specialties.
Yeah.
Yeah, that's a little bit of exposure I had in emergency medicine.
Okay. And how how would you describe the NHS then? What surprised you about the NHS?
Oh, what surprised me here in my first job was the responsibility that you have to do, and when you first enter a job, you're expecting in series,
Yeah.
in like Grey's Anatomy or
Yeah.
something like this. Watch this, you say, oh, it's going to be like this, but once you enter, you realize, it's a busy place and its life is at stake.
Mm,
You have to deal with patient with all their humility, respect, dignity, and compassion, no matter how you're tired, how you feel that day. But when you go and see the patient, you put a different face to
mm,
go forward. So that was things that really quickly you have to grasp, because there's expectations from you, and also for your care of the patient. I think those who come from roots of plabs, they kind of have some training when they do PLAB 2,
hmm.
the interpersonal skill, how to approach the patient, how to take the history, and the way have allow them to give open questions. So it does help to prepare yourself mentally. So when you actually get in there, you can sit back and say, okay, back to square one, back to square one, back to square one.
Yeah.
What you have learned and how to make the to make a proper history or diagnosis with patient.
Yeah, definitely. I know you mentioned some days when you're not feeling at your best, or it's a
Yeah.
really
Yeah.
busy day, and you might be struggling. It's a
Yeah.
very high pressure environment. So on these days where you're not at your best, or you're not feeling, um, everyone has their off days at work. How do you cope with these high pressure environments, and obviously because an A&E department is really
Yeah.
busy?
So in the A&E, you will always have high pressure job, but the most challenging part is possible people talk less about it is, the hours of work. Sometimes you have shift that start from early morning, 8 o'clock, that finish to 6, 5. We have those who start, those are the twilight shift. The night shift are always hard, but I think the twilight shift, the one who just start at 4 p.m. and finish by 2 a.m., are the one that are really challenging, because if you have a set of four shift twilights, you wake up, you finish by 2 o'clock. By the time you go back home, you have a warm shower, you drink something, it's already 3 a.m., 3:30. When you try to get sleep around 4 o'clock, so when you wake up next day, it's already late morning.
Hmm.
So you have very 2 3 hours until you prepare your breakfast. By 2 o'clock, you have to prepare your stuff, so you have to prepare for yourself. So what I do for myself is what you asked me, is either I watch something like, a comedy series, or watch, or if it's early morning and I know I'm fresh, because sometimes you do tend to have a coffee by 2 o'clock or 1:30 if you're doing in the light shift. I just go to a gym. Here in UK you have lots of gym facilities that's open 24 hours, so I can do for a gym. You go for a bike for like 30 40 minutes, then you can get back home and sleep and have a good pattern. These are
Yeah.
things, either go to gym or watch something.
Yeah, gym's a very good stress release, to be honest. I got back in the gym yesterday after 3 weeks off finally.
Yeah, you can
um,
experience muscle sore today then.
yeah, a little bit, yeah. I think tomorrow will be worse.
Yeah.
Okay. I know you've been in the NHS now. Is it almost a year?
Yes, it's
You
almost.
you started off doing a clinical attachment at
uh,
Conquest
yes,
Hospital,
yes.
and now you're at Leighton Hospital. How are you finding it at Leighton?
At the moment, it's super friendly team.
Mhm.
They are very supportive. But the thing is, you're there to do a job. So until you get the job done, you will get appreciated. And I think it's everywhere. You have to take care of yourself. Be the best possible self when you present to work, either physically or mentally. Prepare yourself, what expecting from you. And once you know all these things in your head, you just have and go and deliver and make sure the patient is safe and is being referred, or have a proper plan. You know,
Yeah,
um, Leighton is bigger as compared to Conquest, definitely. So the amount of patient it's you see per day is more.
yeah, good, good. Well, you're getting more exposure. I'm sure
Yeah. Yes.
soon you might
Yes.
be working in a major trauma center, or something one day.
Oh, hopefully that's a plan. That's a plan.
Yeah, one day.
Yeah.
What would you say then is the best thing about working in emergency medicine within the NHS?
Yeah. So I said to you, it's a platform that you're given, the support. Uh, when I first joined the emergency department, it was my first job in the UK. I was surprised the amount of staff they have. I'm not saying about the numbers of doctors. I'm saying about from HCAs to nurse to advanced nurse practitioner to ENP, ANPs, and then you have doctors. You have rotation doctors from FY1, FY2. Then you have SHOs like us. Then you have a bit more senior that get into starting training, ST1, ST2 training to registrar and to consultant. So you have a range. It's a big team. It's a big team.
Yeah,
So um, you should know when you are at difficulties who to approach with. The EMPs and AMPs are mostly very good with minors, so they know the referral system. Then they can help you with the plasters. If you have a fracture, they know the pathway in and out much. So they're the best person to approach. So initially, it take up to a good 1 2 weeks to get to know everyone and what's their role. So that
okay.
it does help. It does help, to lean forward if you need some help on this way or this way. If you need some advice what to do, you're blocked. Then you can
Yeah,
move to a registrar and consultant. And the specialized nurses, and you'll be surprised. And Leighton, they have even pediatric nurses. They have very specialized nurses from emergency nurses to pediatric. They have cardiac nurses, stroke nurse. They all form a team. So it's not just about doctors who run the show.
yeah.
It need everyone to form part of the team.
Yeah, I love that, to be honest. I think it's
Yeah.
it's it's the perfect thing to say, because especially in the emergency medicine department, it's really big. So you need everyone in the team to be doing
Mhm.
well, supporting each
Mhm.
other,
Yeah.
and then that's how you run the department very
Mhm.
efficiently and manage the patients as quickly as efficiently as possible.
Yeah. You play on their forte.
Yeah, exactly.
Yeah. Yeah.
What would you say is the biggest difference then between practicing overseas and practicing in the NHS?
Oh, here you have more support, I would say. You have more
Yeah,
support. You have more support. But back home, when I was, when after finishing my training, I was working as an independent type of. It's like similar. If I compare the job role, it's similar to a GP, to be honest. But uh, back there home, we don't have much support and the connections and how each different specialties, either it's outpatient or in the hospital, are interlink. You can easily get anyone on the call and the phone, and this is a call for referral, this is a call for an opinion. It's easy available. I think
yeah,
this is very very good platform if you want to grow, um, progress in your career.
yeah. Would you say the progression is better in the NHS
Yeah.
as well then? Yeah,
Yes.
I think that's one of the main reasons a
Yeah.
lot of doctors actually relocate here
Yeah.
as well. Um, In terms of then when you first started working at Conquest Hospital, um, a lot of doctors they're quite frightened when they first start in the NHS because
Mm.
it's a whole new system, it's a whole
Mm.
new country, so they're adapting to a lot of new things,
Yeah.
and they feel very out of place. They feel like they should be working at a more junior level than where
Yeah.
they are because of all the changes.
Mm.
What advice would you give to doctors starting in the NHS for the first time? Because I think what's really important is that it's difficult for everyone and it's going to be challenging at first, but over
Yeah.
time you do
Yeah.
start to to get used to things and get more confident and comfortable. What would your advice
So
be to these doctors?
the point that you have raised, I think one at one point of any start doctor who started in the NHS will have this question mark. Oh, am I suited? Am I tailored for this job? Am I confident enough? So you have to go back to your square one, you know, because the medicine part we all has been certified for it. You train 5 years, you have done pre-registration training, you have done 2 years internship, 3 years internship, working independent. The only thing that when you come here is you have to go back to your core principle.
Hmm.
As you as a physician, you know what you can bring, you can treat this person, you can make the person's life better, you can improve their life. But back on you to is you have to be like, self-belief, confident, and get back to your square one, how to take the history, physical examination, do one by one, but as I said, you can only climb a ladder one step at a time,
Yeah,
so at this point, when you feel, just remember, take a deep breath, relax. There's no pressure, no one is judging you. It's just you who always build pressure on yourself. Just get back to square one. Take your history, do your physical examination. Once you get a broad differential, then you're in the right way. If you take a history, do a physical examination, you have nowhere to go. At least at that time, you should go to ask for some help rather than putting yourself in a situation that you say, oh, I'm blocked, I don't know what to do. Because sometimes when you discuss things with colleagues, senior colleagues, they give you different perspective of things, you know
yeah,
we have also lots of facilities, from investigation, from blood test, imaging. You can request any type of blood test and imaging in the A&E. So this is before requesting any images, because sometimes if you don't know what you're looking for, you're just requesting things, you just make yourself more confused. So
yeah,
if you go back to yourself, take your history, do your physical examination, still you're confused, not very sure, get someone senior or a colleague, just tell them, like, okay, I have this patient, this age, I have done this, I have asked this, um, possibly this, can you help me to make a diagnosis? Because there's few things in that when you take histories that you have to consider, that these are emergencies, these are
hmm
things that you have to make sure it's not that. Then you can think about others, less life threatening.
yeah,
Yeah.
definitely. And I think when you're first starting as well, it's very important to just to keep asking questions. Never
Yes.
be afraid to keep asking
Yeah.
questions,
Yes.
because there's going to be a lot more people who are more senior in the department who have been in the same position
Yes.
as you as new doctors, so they'll be able to share their experiences as well, and be able to help. As you mentioned, the support in the NHS is one of the best things. So
Yeah.
it's definitely important to keep asking questions, um, rather than just going around shadowing all the time. Exactly, and just double check things all the time
Yeah.
too.
Yeah.
Okay, well, to be honest, I think that's all the questions I had for you. But I think that the most important question is Liverpool making the top four?
Ah, I have my reservations for that.
Yeah, I don't want to talk about it. Well, thank you so much for your time, Vikesh.
No worries.
Um, it's always a pleasure speaking with you. And I wish you the best with your family and your child coming soon. Do you know if it's a boy or a girl?
Yes, it's a baby girl.
Ah, beautiful, beautiful. I'm very
Thank you
happy
so
for
much.
you.